low back pain and fascia restrictions. And you could look at low back pain as disc issues, spondylolisthesis, stenosis, and all of the other myriad of diagnoses that basically tell you you have something going on in your spine and you're experiencing back pain or radiating pain down the leg and hips along with the back pain or by itself. So if the spine is all lined up and straight, our vertebrae are all lined up and our discs are in the middle. And there is literally freedom of movement in directions, pain-free freedom of movement, and your nerves are not being pulled and squished in interesting directions. Now, let's change that, right? Let's give Erin a myofascial restriction, and I want you to see from the back, ignoring this lovely little spider, which I'm going to squish in a second, I want you to see from the back what that does to his spine and imagine what that does to the skeleton and the bones and the discs. So, right, if I'm going to give Erin that famous fascial restriction all the way here, can you see these lines of pull here that just happened? Do you think that in this position, the back muscles are balanced on the right and on the left? Do you think the vertebral discs on the right and on the left are experiencing the same thing? How about the nerves that exit out to the side? They're being squeezed and pinched on this side. You can have sciatica down this leg. And over here, your discs are your vertebrae are gapping open, your discs are heading out, and that can give you disc bulge and symptoms down the other leg. So if you keep getting treated at your low back for any kind of low back diagnosis or pain, and it's not going away, maybe you need to look all the way down over here at the right calf to start to see, was there an adaptation and remodeling around sport or injury, and start to free that up. And I mean visibly see, right? The zipper goes to the front, right? You can imagine the spinal column, what that looks like. So Erin, go ahead and bend to the right. And you can see that spinal bend, and there's going to be a twist. And if we free it up, can you imagine what it feels like walking around with your spine like this? Or walking around, bend to the right again for me, Erin. Imagine what it feels like walking around with your spine like this. Ouch.